Hello everyone, my name is Sophia, and for those of you who don't know me, I am a nursing student. In today's video, I wanted to talk to you all about what to expect your first semester of nursing school. So for those of you who don't know me, I will be graduating this December 2020 with my Bachelor's of Science in Nursing. So when I first started off my first semester of nursing school, I wish I had watched some videos and kind of known what to expect my first semester of nursing school. Now, my first semester of nursing school was definitely the most challenging semester for me. And in this video, I just wanted to talk to you all about what to expect in different areas of nursing school your very first semester. So I'll be talking about like the classes you'll take your first semester, clinicals, like social life changes, and some personal changes you might experience during nursing school. I hope that this video helps you all to kind of know what to then expect your first semester of nursing school. And a big congratulations on getting into nursing school, because getting into nursing school is a big accomplishment in itself. So without further ado, let's begin. Okay, so the first area that I want to talk about is your classes that you'll be taking your first semester of nursing school. So the classes that I had to take my first semester of nursing school were pharmacology, an assessment course, and a clinical competencies course. So pharmacology was, of course, learning about drugs, and I felt that this class was strictly just a lot of memorization. I did do really well in this class, and I'll be filming a video later on how I got an A in pharmacology. This is a class that a lot of people do struggle with their first semester, but I think that as long as you find the way that you memorize well, you should be pretty good with this class. The next class that I took was assessment class, and this class was all about how to assess a person, like from head to toe, and looking at the different body systems and how to assess all of the different body systems. So in this class, we would have a 3-hour lecture every week, as well as a lab component every week, where we had to practice in lab for 4 hours on practicing assessing each other, and we did a different body system every week. The third class that I took was clinical competencies. This course was all about kind of your main nursing skills and concepts. And in this course, we learned about like asepsis, we learned about different like oxygen devices, the different positionings of patients, and it was all just basic foundational knowledge that you had to know for nursing. And for this class, we had a 3-hour lecture every week, in addition to a clinical component where we had a clinical at a hospital. Now, this course was probably the most challenging for me because it was a lot of application, in that you had a clinical component, but also in that your tests were a lot of application of your material that you've learned. So this class was not just memorization, it was all about applying what you've learned to different nursing scenarios on the test, and it was a lot of select all then apply questions. What made this class really hard was that you had very NCLEX style questions, which require critical thinking and application, and it's not just memorization. So this course definitely took some time getting used to, because coming from your prerequisite classes, which were a lot of memorization, it was now really trying to think as a nurse in this class, and that's what kind of made it very difficult. So for these classes, my tip for you is you have to try to find a balance between knowing and doing. Of course, you have to have your main knowledge over different nursing topics, but your doing also comes from the fact that in some of these classes, like assessment and clinical competencies, you are having to apply what you know into different skills, like when you're assessing a patient, or in clinicals as well. These 3 classes really kind of set the foundation of your entire nursing career. So it's important that you try to learn as much as you can from these courses, because what you learn from these 3 courses, you will be using throughout your entire nursing school journey and even in your daily life as a nurse when you graduate. Okay, so the next area that I want to talk to you all is about tests and grades in nursing school. So in nursing school, your grades just pretty much come from tests. At least that's how it was in my school. Your tests make up your grades, and there isn't really any other assignments that count towards your grade. So in most of my classes, we had 4 exams that make up our entire grade in the class. And also in nursing school, on almost every single one of your tests in class, you will have select all that apply questions, in which you don't just have one answer for every question, but you could have multiple correct answers. And that can be kind of difficult and challenging to try to get used to. And one thing that's really hard when you are coming into nursing school and you really take like your first 2 exams, what's hard is trying to get used to the style of nursing questions on tests, because they are really formulated like your NCLEX that you'll take when you graduate. So it is kind of overwhelming and difficult to get used to these questions. But if I could give you all any piece of advice, it would be to do practice questions so that you kind of get more familiar with these style of questions and you aren't so kind of like confused and thrown off when you take your first exam. Try to do some practice questions before your exam. Now, another thing I want to talk about is nursing school classes are pretty difficult to get an A in. Now, I'm not saying that it's impossible to get an A in them, but it does take a lot of work and sometimes it's just not possible. Instead, you might be getting some B's or even C's in a class. And honestly, that is okay. Don't be too hard on yourself in nursing school. These are challenging courses, so you can't put so much pressure on yourself to get an A. The next area that I want to talk about is what to expect in clinicals. So for my first semester of nursing school, we only went to clinicals for half of the semester. Clinicals your first semester is just kind of getting your feet wet. There's not too much that you can do your first semester, so don't expect to be able to do a ton of skills or anything like that your first semester. It's just really starting off slowly and learning how to do like the basics. So what we were able to do our first semester was do assessments on patients. We got to practice doing those on patients from head to toe, doing skin assessments, neuro assessments, stuff like that. We were also able to pass meds our first semester, but the only meds that we could do were oral and topical medications. We weren't able to do any IV medications our first semester of nursing school. And we weren't able to do any hard skills like starting IVs or inserting NG tubes or anything like that. Only really kind of hard skills we were able to do were inserting Foley catheters, and we were able to give injections, but the injections could only be the subcutaneous injections. We weren't able to do any muscular ones. We also had care plans that we had to do our first semester of nursing school, which were kind of lengthy. There was a lot we had to include, like our nursing diagnoses we would give, our interventions for the patient's diagnosis, and we would have to talk about the meds that the patient was on and the side effects and why they were on that med. And we would have to write this all out in a care plan, and then our instructor would grade these care plans and give us advice. And the care plans are really just meant to be able to understand a patient's condition and what nursing interventions you would do for their condition. So clinicals your very first semester, you just kind of have to be patient. Don't get to expect to do a ton of stuff, but you will your second semester. My second semester I was able to do a lot more. That's when we were able to give IV medications and start IVs and do some more challenging skills as well. The next area that I wanted to talk to you all is about your social life in nursing school and what to expect that can change with your social life when you first start nursing school. So your social life, you might feel like that you don't have any time to now spend with your family and your friends because you're just constantly studying and you're so busy with clinicals and getting up early and staying up late at night to study, and you might feel like you have no time for anybody. And I definitely felt that way my first semester of nursing school because it's just very overwhelming getting used to so much responsibility and courses that you have to take your first semester. But I do want to say that it is possible to still have a social life as long as you manage your time well. I think that if you learn to kind of study each day and be productive each day, it's possible to still, go to people's events and to hang out with family and friends. I think it's really doable as long as you just manage your time well. Another thing is that you can't expect to make a lot of friends your first semester of nursing school, especially with your clinical group. So your clinical group is a group that you'll have clinicals with all semester. And so it's really good to get close to these people. You're going to be spending a lot of time with them. And it's really good to, get your clinical group members' phone numbers and to be able to text them if you have any questions, maybe start a group chat so you all can help each other out and where you all can just support each other and vent to each other or whatever you need to do. Okay, the next area that I want to talk to you all is about some personal changes you might experience in nursing school. And what I mean by this is kind of some emotional changes you might be dealing with in nursing school. So one is that you might feel a lot more stressed because, again, everything is so new to you. These classes can be really challenging and you have a lot of deadlines and tests, and that can build up a lot of stress, and that's completely normal. But I do want to tell you all to try to find ways to manage your stress. Finding ways to manage your stress is so important. I would say just once a week, just try to schedule something where you can look forward to that and you can relax that day. Or maybe it doesn't have to be the entire day, just a couple hours every week to just kind of decompress. Another thing you might be dealing with when you start nursing school is the feeling of being unconfident. This is really common because, again, you are expected to learn so many skills and you're expected to just know so much, and you can start to feel really unconfident in yourself, in your abilities. And if you guys are struggling with this, there are some ways to try to gain more confidence. I have a video on how to gain confidence in nursing school, and I recommend you guys check that out if you are kind of dealing with feelings of unconfidence in nursing school. So overall, just know that you have to be patient with yourself throughout this time of nursing school. Your first semester, it's a lot, and just try to work on being flexible and knowing that this is all just a big adjustment right now, and it will get better, I promise you. So if you guys have any questions about nursing school, leave me a comment down below. I would be so happy to help you all. Also, check out my video on how to gain confidence in nursing school, and if you guys have any video recommendations for me, leave me a comment down below and please subscribe. So thank you all so much for watching, and I will talk to you all later. Bye.